Hi, I'm Dr. Meghan Davis, and I would like to describe some tests for colon cancer. These tests can detect cancer early when it is curable. The colon is where your food travels to after it leaves your stomach. It is a hollow tube around 5 to 6 feet long and ends at the rectum and anus. Other names for colon include large intestine, large bowel, your guts, or your insides. You may hear things like colorectal cancer or bowel cancer. In this video, to keep it simple, we will call it colon cancer. You can get colon cancer even if no one in your family has it. Colon cancer is the fourth most common cancer for men and women living in Canada. It is the second most common cause of death from cancer. If you are between the ages of 50 and 74, you should be checked for colon cancer. Routine tests can find cancer early, and 9 out of 10 people can be cured if it is found early. If your parents or brothers or sisters have colon cancer, you might need to be checked younger than 50. I'll talk more about this later. Colon cancer starts as tiny polyps that grow inside your colon. Not all polyps will turn into cancer, but some can. Here is a picture of a polyp that starts small and then grows into a cancer. The cancer slowly grows and invades through the wall of the colon and can then spread to the rest of the body. Now, polyps grow very slowly over years. Once a cancer develops, it too grows slowly over years. If we can find them and remove the polyps early, it can prevent them from becoming cancer. If we can find the cancer early, the chances are it can be removed completely and cured. There are 3 tests to try and find colon cancer early. The poop test, also called fecal occult blood or FOBT for short. The flexible sigmoidoscopy test, which is a short tube with a camera that goes up part of the intestine. And finally, there is the colonoscopy, which is done at a hospital, and it looks at the whole colon with a small camera. I'll be describing each of these tests next, but first, which one should you have? If you are a man or woman over age 50 and under age 74, and if you do not have an immediate family member with colon cancer, then you should get the poop test. You may also choose to have a flexible sigmoidoscopy. For all men and women with an immediate family member, brother, sister, or parents who've had colorectal cancer, then you should get a colonoscopy. If you are a man or woman over age 50 and under age 74, and if you do not have an immediate family member with colon cancer, then you should get the poop test. To do this test, you need a kit from your doctor, and then you need to collect some of your poop when you're at home and you mail it into the lab. The first step is to plan for the kit. 3 days before the test and during the test, do not eat any citrus fruit or juice. This includes vitamin C supplements. You will be testing 3 different poop specimens on 3 different days. You will be collecting 2 samples from each of these 3 poop specimens. If it takes over 10 days to do this, the kit won't be analyzed, so try to complete it all within 10 days. Some people find it helpful to use a calendar. You can mark the first day you took the sample to make sure you get all the samples taken before 10 days are up. So let's get going. Here's exactly how to do the kit. Unpack the kit and you will find the test, 3 sticks, 2 envelopes, the instructions, and a lab requisition. Before you start, please make sure the front of the kit is labeled correctly. It has to have your name and date of birth. The lab will not examine kits that aren't labeled properly, and you won't want to go through all of this for nothing. When writing your name, please make sure it's written exactly the same way as it is printed on the requisition that came with the kit. Write the name and date on your first sample. Flush the toilet bowl to make sure it is clean. Do not use toilets with bowl cleaners. The water should be clear, not blue. Use a disposable paper plate, pie pan, or line the toilet bowl with paper towel. Use the wooden stick to scoop a tiny amount of the poop from the surface of the poop. You only need a thin smear that fits within the test area. More is not any more accurate, it's just messier. The screen will absorb any blood if there is any. Smear this inside test flap area 1. Use the same scoop to scoop a second poop sample from the surface of a different part of your poop and smear it inside test flap area 2. Close the flap and put the card in the foil-lined envelope and keep it at room temperature. Throw out the stick and the disposable container, flush the toilet, and you're done. The first of 3 samples. Repeat this for 2 more days, making sure you write the name and date on your sample. Complete this within a 10-day time frame. It doesn't have to be days in a row. It just has to be within the 10-day period. Some people wonder, why is this test so complicated? Why so many samples? Here's the answer. The test is for blood that is not visible to the naked eye, or occult blood. The blood comes from the large polyps or from the colon cancers that are on the wall of your colon. As the colon pushes the poop out, the poop scrapes along the wall of the colon and picks up the blood from the cancer. But the colon changes shape all the time while it's working, so doing 3 sample days, each with a bit of poop from 2 different spots, increases the chances that we will find this invisible blood. Here's a story from Ernie. When Ernie did his first sample, his golf buddies told him to take 3 samples from the same poop just to get it over with. And the first time that's what he did, and it came back negative or normal. The second time he decided to follow the instructions exactly, and he took his sample from 3 different days, and it came back showing that something was wrong, and he was stunned. So his message is, you only cheat yourself if you don't do it right. After the 3rd sample is collected, place the test card inside the foil-lined envelope, put this smaller envelope and the requisition form into the larger envelope, seal it tightly, and mail it off. The postage is paid. Your family doctor will get the results, and you will also receive a letter from the Colon Cancer Check program. If the poop test is positive, please see your primary care provider to arrange a colonoscopy. Although if the poop is negative, it is good news. Please remember that not all colon cancers bleed all the time, but they do grow slowly, so make sure you get another test in 2 years. Each time you do the test, it significantly increases the likelihood that if there are large polyps or cancer, they will be found and removed. Another option for screening, if you have no family history of colorectal cancer in your immediate family, is the flexible sigmoidoscopy. This test looks at the left and lower part of the colon with the camera. It does not require sedation, and the preparation is simple. It raises the chance of finding cancer from 25% with a single FOBT or poop test to between 60 to 80%. If there is a registered nurse-led program in your area, you may wish to discuss this test with your primary care provider. Alternatively, the flexible sigmoidoscopy test can be performed by any doctor with training in endoscopy. The last test I would like to talk about is the colonoscopy. This is a procedure to look inside your entire colon. A flexible tube with a camera and a light at the end is used to see inside your colon. A trained doctor or nurse practitioner does this test in a hospital or an endoscopy facility. Also, as I mentioned at the beginning, if your mother, father, brothers, or sisters had colon cancer, you should get a colonoscopy instead of a poop test. You should get your first colonoscopy depending on the age at which your relative was diagnosed. You should get the scope done 10 years before their age of diagnosis or at age 50, whichever is soonest. For example, if your father was diagnosed with bowel cancer at age 50, you would have your first colonoscopy at age 40. Also, some patients with diseases such as Crohn's, ulcerative colitis, or undiagnosed rectal bleeding, or a hereditary colon cancer syndrome, where you and your family members have a gene that causes cancer, should get regular colonoscopies instead of the poop test. You have to prepare for the colonoscopy by cleaning out all of the poop from the entire colon so the doctor can see all the walls and find any polyps. The day before the test, you will need to drink a liquid that you buy from the drugstores that will give you a very loose poop. Here are the steps to a colonoscopy. You will check into the hospital or the endoscopy facility and change into a gown. A nurse will start an IV, and once in the exam room, if you choose to, you will be given a sedation to make you comfortable and a bit sleepy. They will insert the flexible tube into your bum and inflate the entire colon and look closely at the walls. If there's a polyp, it will be removed. If there is a cancer, they will take a sample to look at it in the lab. There will be a nurse in the room to help you and to help you recover, and you will need someone to take you home because of the sedation. Let's summarize what your options are to get screened for colon cancer. If you are between the ages of 50 and 74 and you do not have a family history, so parents, brother, or sister with colorectal cancer, get screened with the poop test or the fecal occult blood test. If you are between the ages of 50 and 74 and do not have a family history of colorectal cancer, you also may be eligible to get screened with a flexible sigmoidoscopy, which can be performed by a trained nurse if that's available in your area, or by a physician. If you have a history of colorectal cancer in your family, then a colonoscopy is best for you. You should start at age 50 or 10 years before your family member was diagnosed, whichever comes first. Speak to your primary care provider to help you decide which test is right for you. Whatever you decide, please make sure to get screened for colorectal cancer. And thanks for listening.